Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the July 2nd, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. I want to remind everyone who the Public Health Incident Management Team is. It consists of myself, Dubuque County Health Department Director Patrice Lambert, Visiting Nurse Association Director Stacy Killian, and the Dubuque County Emergency Management Agency Director Tom Berger, with input from both hospitals and the healthcare providers. We're coordinating our response efforts in conjunction with the Iowa Department of Public Health, the Governor's Office, and with guidance from the Center for Disease Control and Prevention. Dubuque County added 59 new COVID cases since yesterday and 122 since my update on Monday, June 29th. As of July 2nd, Dubuque County has 595 positive COVID-19 cases. No additional deaths were reported, so a total of 22 deaths in Dubuque County remains. About 5% of the just over 11,000 people tested in Dubuque County have been positive. 5 individuals are currently hospitalized, and 388 people, or about 65% of all Dubuque County cases, have recovered to date. The state added 722 cases since yesterday. As of July 2nd, 2020, Iowa has a total of 30,132 positive cases. That's about 3,000 more than I reported on Monday. In all, about 1 in 10 Iowans, or almost 24,000 people, have been tested, and about 10% of the Iowans tested have been positive. Deaths reported in the state total 717 Iowans. Currently, 145 cases are hospitalized throughout the state, and about 79% of Iowans have recovered. Today's positive case count is the highest we've experienced here in Dubuque County, and I'm sure the totals will change when you're watching this. We know quite a few young adults are part of this increase in cases. We also know that for the most part, they are not experiencing severe symptoms or sometimes even obvious symptoms. This continues to be the reason for all of us to maintain physical distancing by staying a minimum of 6 feet from others when you're out in the community, whether it be at a store, a restaurant, etc. And we can't let our guard down wearing masks when out in public, and also continue with proper hand washing. You may unknowingly expose yourself to a positive case who is not exhibiting symptoms or only has mild symptoms that are not obvious. A couple of days ago, in his testimony to the Senate committee in Washington, D.C., Dr. Anthony Fauci warned that the United States could see a daily COVID-19 case count of 100,000 if the current surge of cases continues. Yesterday's national case count was over 50,000. Needless to say, Dr. Fauci is concerned, and so are we. We are monitoring our increasing case count and also the hospitalizations and deaths, which are remaining fairly stable. But as more widespread community transmission occurs, even among the typically healthy young adult population, the virus will then be passed on to our more vulnerable elderly population and also to those with high blood pressure, respiratory issues, diabetes, and compromised immune systems, and other chronic health conditions. Not to mention the strain a surge in these populations would have a direct impact on our clinics and hospitals' ability to treat not only COVID-19 patients, but anyone needing health care. The Iowa test site at Epic Health and Wellness Clinic on Cedar Cross Road will continue next week, starting on Monday. If you're exposed to a positive COVID-19 case, you probably will not be able to be tested this weekend due to the holiday. However, regardless of whether you get tested, if you're exposed to a positive case, meaning you've had contact for 15 minutes within 6 feet or greater, you need to begin quarantine for the 14-day period. And this quarantine must happen whether you test positive or negative. Anyone who has direct exposure should stay home for 14 days and watch for signs and symptoms. So start that as soon as you become aware that you've had that exposure to a positive case. So, it's the 4th of July weekend. Many of the usual 4th of July celebrations have been canceled or postponed. A few venues are doing fireworks, and a few community events are still happening. Depending on where you watch fireworks, you can allow yourself plenty of physical distancing. However, stay away from crowds watching fireworks. These gatherings are a potential exposure, especially considering the current community-wide spread and number of cases. Our advice is celebrate the 4th of July in your own backyard or in an area, perhaps a park, where large distances between groups can be maintained. Celebrate with household members or small groups of people, and preferably outdoors or in well-ventilated areas. Stay home or make essential trips only to the store. Wearing a mask, of course. Go back to curbside pickup or delivery for groceries and take out from restaurants. And wear a mask when you go out. And wear it properly, covering your nose and your mouth. Thanks for tuning in today. Let's all be safe and practice proper public health measures. We're back to, when in doubt, don't go out. And remember, we're all in this together.